What's going on, lovely people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my cardiology playlist. Today we shall talk about dilated cardiomyopathy. What does pathy mean? Pathology, disease. What does myo mean? Muscle. What kind of muscle? Cardio, heart muscle. So pathology of the heart muscle, okay? And describe that pathology. The muscle is dilated, just like this. Look how big the cavity is. Sometimes this is referred to as eccentric hypertrophy, as opposed to concentric hypertrophy. Patients with dilated cardiomyopathy might suffer from symptoms that mimic the symptoms of heart failure. In dilated cardiomyopathy, we have dilation and impaired contraction of one or both of the ventricles of the heart, which is not wholly the result of hypertension, coronary atherosclerosis, valvular dysfunction, congenital, or other structural disease. Click the like button, click the subscribe button, and let's get started. Please watch the videos in this cardiology playlist in order for maximum understanding and retention. Back to basics. Here's my heart. Here's the wall of the heart. Inner layer is endocardium. Middle layer, or the cardiac muscle layer, is the myocardium. Myo means muscle. And then around the heart, what do we have? The pericardium, the outermost layer. If I have dilated cardiomyopathy, where's the problem then? The problem is in the myocardium, hence cardiomyopathy. How many types of cardiomyopathy do we have? Many, including dilated cardiomyopathy, today's topic, also known as congestive cardiomyopathy, because the patient might have congestive heart failure symptoms. Then we have hypertrophic cardiomyopathy, also known as hypertrophic obstructive cardiomyopathy, idiopathic hypertrophic subaortic stenosis, or asymmetrical septal hypertrophy, all terms discovering the same disease. Then we have restrictive cardiomyopathy, also known as infiltrative cardiomyopathy, because my heart muscles have been infiltrated with something. Let's say amyloid proteins in amyloidosis, or fibrosis, or fibroelastosis, etc. Takotsubo cardiomyopathy, or broken heart syndrome, or stress cardiomyopathy, which we have talked about in another video. And we also have chemically induced cardiomyopathy. What kind of chemicals are we talking? Alcohol, cocaine, amphetamines, anabolic steroids, some antibiotics and chemotherapeutic agents as chloroquine, 5-FU, FU back, doxorubicin, also known as adriamycin, which is one of the anthracyclines, and cyclophosphamide, one of the alkylating agents. In dilated cardiomyopathy, I'm very good at relaxing and accepting the blood because I'm dilated, I'm wide open, bring in the blood. So I'm very good at diastole, but I suck at systole. Hypertrophic is the exact opposite. I'm very good at systole because I have strong muscles here. However, I suck at diastole because everything is narrow, thanks to the asymmetric hypertrophy. Restrictive cardiomyopathy. Whenever you hear the word restrictive, think restricted from filling. I cannot fill. I suck at diastole. In Takotsubo cardiomyopathy, we have ballooning of the left ventricle, just like the Takotsubo pot, used by the Japanese fishermen to catch octopus. Just remember, dilated cardiomyopathy is a heart that is good at diastole, but bad at systole. If you want to learn about stress cardiomyopathy or Takotsubo cardiomyopathy, I have a separate video for it. You'll find it here in this cardiology playlist. Look at this. Here is my normal heart cross-section. This is the right ventricle. Here's the right ventricular wall. Here's the right ventricular cavity. And this is the interventricular septum. This one is the left ventricle. Here's the wall, and here's the cavity. If my normal heart came under the attack of volume overload for a long period of time, it can become like this, and this is called eccentric hypertrophy. I am growing outwards. However, if my heart came under the attack of pressure overload for a long period of time, I get this, concentric hypertrophy. I grow inward concentrically, layer upon layer upon layer, added in parallel, just like this. You can draw this. Here is the layer of my heart, and then I added a layer, and another layer, and another layer, and another layer. Look at this. This is concentric hypertrophy. What causes eccentric hypertrophy? Volume overload. What causes concentric hypertrophy? Pressure overload. What's the cause of eccentric hypertrophy? Well, when I say volume overload, I mean what? Increased preload, the blood that's coming to the heart. The load that the heart feels after it pumps the blood, such as high systemic arterial blood pressure in the big arteries. So patients with systemic hypertension can develop what? Concentric hypertrophy. Can you give me examples of eccentric hypertrophy? How about regurgitating murmurs? How about aortic regurgitation? Let's draw the heart. Here's the left ventricle and here's the aorta. Okay, I have aortic regurgitation, blood coming from the aorta, returning back to the left ventricle. This is what? This is volume overload onto the left ventricle because it happens before this left ventricle contracts. So it is indeed an increased preload. How about mitral regurg? Same idea. The blood is regurgitating from the left ventricle to the left atrium. In the next cycle, the left atrium will give more blood to the left ventricle, and this is increased preload. Dilated cardiomyopathy. Look how dilated I am. This is dilation. This is eccentric hypertrophy. But on the other hand, concentric hypertrophy. How about stenosis of the aortic valve? If this aortic valve here is narrow, what's going to happen? Left ventricle will try to contract to push the blood forwards. But I'm going to encounter very high resistance after I pump my blood. This is increased afterload. This is also seen in hypertrophic cardiomyopathy, which is the topic of the next video in this cardiology playlist. Cases of volume overload or increased preload will give me S3 heart sound. When you open the water tap very quickly, a gush of fluid is returning to the ventricle quickly. This is volume overload, swish. S3. However, when there is increased afterload or pressure overload after I pump, I encounter high resistance, it gives me S4 heart sound. That's why patients with systemic hypertension get S4 heart sound, but patients with aortic regurgitation or mitral regurgitation develop S3 heart sound most of it. Next, on a histological basis, here is the normal muscle. Okay, normal cardiac muscle, beautiful sarcomeres. In eccentric hypertrophy, I am adding muscle sarcomeres in series. So this has been added next to this. Oh, what's going to happen? You'll get a longer wall, more elongated and more dilated. However, in concentric hypertrophy, I added them in series. You get a thicker wall, narrower cavity. Oh, by the way, you can download these doozy notes on my website, medicosisperfectionalis.com. If you want to understand dilated cardiomyopathy really well, bring a pencil and paper and let's do it. Here's the right side of the heart with the blue color, and here's the left side of the heart with the red color. The ventricle is super duper duper dilated. Okay, and what? And we act as congestive heart failure. So there is the right side and there's the left side. Symptoms of failure of the right side of the heart will lead to what? Something upstairs, something downstairs, and something in between. What's upstairs? Jugular venous distension because the blood is backing up. What's downstairs? Lower extremity edema. And what's in the middle? Distension of the hepatic capsule, congestion of the liver, you can say hepatomegaly. This is what we call cardiac cirrhosis, a problem in the liver caused by a problem in the heart. Which reminds me of cor pulmonale, a problem in the pulmonale causing a problem in la cœur, the heart. Next, symptoms and signs of left-sided heart failure. Well, I have congestion in the lung, so pulmonary congestion. I can get pulmonary edema. The patient will have cough, shortness of breath, also known as dyspnea, orthopnea, paroxysmal nocturnal dyspnea, sometimes hemoptysis, and even repeated chest infections. What do you hear with your stethoscope? I hear crackles, wet or dry, wet crackles. Also known as râle de la mort, the rattles of death. When my lungs sound like the inside of an Egyptian hookah. Air bubbles, air mixed with fluid. Air in the lungs mixed with fluids from the left heart. And when I have left side heart failure, what's going to happen to my cardiac output? It will decrease, so I get symptoms of low cardiac output, including presyncope, syncope, dizziness, fatigue, drowsiness, exercise intolerance, and much more. Remember, in dilated cardiomyopathy, my heart is very good at diastole, but it's so bad at systole. That's why cardiac output is low, that's why stroke volume was low, and that's why ejection fraction is also low. When cardiac output is low, what's going to happen to my blood pressure, please? It decreases. And look at this. When the ventricle dilates, who's going to be stretched out? The poor mitral valve. And when the mitral valve is stretched out like this, what's going to happen? Blood will regurgitate back from the left ventricle to the left atrium. which means dilation of a ventricle causes regurgitation of a valve. So I get mitral regurgitation on the left side and tricuspid regurgitation on the right side. Can I hear the murmur of mitral regurgitation and the murmur of tricuspid regurgitation? Absolutely yes. What does the murmur sound like? Pansystolic murmur, high-pitched. The mitral one is heard best at the apex of the heart, but the tricuspid is heard best at the left lower sternal border. If I do chest x-ray, what would I see? I'll see signs of congestion of the lungs. So I can see the famous bat wing sign. Oh, that's congestion for you. I can see curly B lines. That's congestion for you. I can see syphilization of the vasculature. That's congestion for you. When the vessels are congested, they are filled with blood. They appear bigger. And you will see vessels that are closer to the apex of the lung, and normally you should not be able to see them clearly. But here, because they're so big, you can see them. And this is what happens in dilated cardiomyopathy. Please take a moment to rest and digest. It's as if I'm talking to the parasympathetic system. If you'd like to see more cardiology videos in the future, please drop a heart in the comments. Enough with these medical dad jokes. Dilated cardiomyopathy causes. I have the A, B, C, D, E, F, G, H, I, and then you go PST. A. Alcoholism, adenovirus, obstructive sleep apnea, acromegaly, and autoimmunity. Have you ever heard of anti-heart antibodies? Yes, indeed, they do exist. Beriberi, or vitamin B1 deficiency, which is thiamine, not to be confused with thymine. Thymine is a nitrogenous base in your DNA, but thiamine is vitamin B1. Next, C. Cocaine, Coxsackie B virus. Coxsackie A will give me rash. The famous hand-foot-mouth disease, but Coxsackie B will give me heart issues. Cytomegalovirus, Chagas disease, Trypanosoma cruzi, American trypanosomiasis, or trypanosomiasis of the New World. What's the name of the trypanosoma of the Old World? Trypanosoma brucei. What's the name of the disease caused by Trypanosoma brucei? Let me know your answer in the comments. Another C, cirrhosis. Then the D, doxorubicin, also known as adriamycin. Echovirus, familial or genetic causes such as TTN mutation, which literally stands for titin protein. The gene codes for the protein. If the gene is mutated, the protein is defective. If I have defective in my titin, which should keep my sarcomeres tight, I get the opposite of tight. I get dilated, just like the nonsense that I see right here. See, medicine makes so much sense once you understand what the flip you're talking about. If you want to learn more about titin, please refer to my muscle physiology playlist. The G, glue sniffers hot. Oh, is that correct? Yeah, alcohol can do it, cocaine can do it, and sniffing glue can dilate your heart. That's some Joe Rogan action right there. Just kidding. Next, genetic inherited hemochromatosis. The primary hemochromatosis. Where's the problem? Well, look at this. Hemochromatosis, it's hereditary because a problem in iron. So it's called HFE gene. Fe, iron. It drives me absolutely nuts when students get this question wrong on the exam. I mean, come on. The name of the gene tells you everything. Hyperthyroidism and hypothyroidism can lead to dilated cardiomyopathy. In fact, hypothyroidism can lead to many disasters in the heart. And if you've watched my video on cardiac tamponade, I've told you that mixed edema is one of the rare causes of subacute or chronic accumulation of pericardial fluid that can lead to tamponade. A fact that most doctors, even most cardiologists, do not know. Please do not be another doofus with a stethoscope. We have enough of those already. Human herpes virus 6 can lead to dilated cardiomyopathy. What else is caused by HHV6? Comment below. HIV can also affect the heart. Ischemic heart disease, of course, can lead to cardiomyopathy. Pregnancy, especially peripartum cardiomyopathy, a topic which we discussed in detail in my OBGYN high yields course, which you can find on my website, medicosisperfectionalis.com. Next, sarcoidosis, lupus, and supraventricular tachycardias. Tuberculosis can do it, toxoplasmosis can do it, trichinosis, and Takotsubo-cardiomyopathy. So here's an example of one cardiomyopathy causing another cardiomyopathy. Think about that. Now let's summarize what we've discussed on dilated cardiomyopathy in one slide. It's also known as congestive cardiomyopathy. History, most common in males between age 30 and age 50. I did not say that only those males get it. Anyone can get it, but it's more common in this demographic. So, dilated cardiomyopathy is more common in males between 30 and 50, but Takotsubo cardiomyopathy or stress cardiomyopathy is more common in females above 50. Which genetic disease can lead to it? TTN mutation in the titin gene, defective titin protein, which is a sarcomere protein, and here are the causes again. For your board exam, they love to ask you about alcohol, beriberi, coxsackie, cocaine, chagas, and doxorubicin. And for the excellent student, also remember hemochromatosis and pregnancy. Signs and symptoms of congestive heart failure. S3 gallop is more common than S4 gallop. Here are the symptoms of right-sided heart failure, and here are symptoms of left-sided heart failure. When my heart is dilated, it is good at diastole, but it's bad at systole. If it's bad at systole, the systolic blood pressure will be low, and that's why the pulse pressure is narrower, because the pulse pressure is the difference between the systolic blood pressure and the diastolic blood pressure. What's going on in this disease? Myocardial dilation, good at diastole, bad at systole, which means impaired cardiac contraction on the left and the right side of the heart. There is decreased stroke volume, decreased ejection fraction, decreased cardiac output, and sometimes decreased blood pressure. But don't forget that many of these guys already have hypertension for another reason. So hypotension is not always the case. The patient can present with hypertension. How can I diagnose this? Clinically, by history and physical exam, you can do an EKG, echo, chest x-ray. If you do chest x-ray, you can find the signs of pulmonary congestion, such as the bat wing sign, syphilization of the vasculature, and the curly B lines. You can also find cardiomegaly, big dilated heart. If you do an echo, 4 chambers are enlarged, especially the left ventricle. You need to exclude everything else before you can say this patient has dilated cardiomyopathy. In many cases, troponin is elevated. Just because the serum troponin is high doesn't necessarily mean that it's a myocardial infarction. It could be cardiomyopathy. Myo, muscle of the heart. What's inside cardiac muscles? If you remember your muscle physiology, you will recall that cardiac muscle cells have troponin in them. Okay, and what's going to happen if this cell is damaged, as in myocardial infarction or cardiomyopathy? When the cell is damaged, troponin will leak to the outside world, into the serum, raising my serum troponin. We can also see this in myocarditis or myopericarditis, among other causes. How can we manage this patient? Treat the underlying cause. If it's alcohol, stop it. If it's cocaine, stop it. Doxorubicin, try to find an alternative. Chagas disease, treat it. Hemochromatosis, chelate it. Vitamin B1 deficiency, replace it. Obstructive sleep apnea, dilate it. That was beautiful. What else? Diet and exercise. Low sodium diet, exercise is very important. Then we have medical and surgical. What are we trying to do? Well, look at our symptoms. Okay, they look like what? Congestive heart failure. So the same medications for CHF. Beta blockers such as metoprolol, ACE inhibitors like lisinopril, angiotensin receptor blockers like losartan, aldosterone receptor blockers, the famous spironolactone. Spironolactone is very good for heart failure. Sodium glucose cotransporter 2 inhibitor or SGLT2 inhibitor. Oh, this is kidney, right? Yeah. Kidney does what? Urine flow. So it's canagliflozin, dapagliflozin. When you see the flow, think of kidneys. Diuretics can help. Digoxin might help. Hydralazine and nitrates to try to decrease the volume overload. Surgical management, heart transplant, pacemaker, or implantable cardioverter defibrillator, depending on the patient's case. Anytime you stretch your myocardium like this, you can get arrhythmias, hence the pacemaker. If you want to learn about the different types of shock like cardiogenic shock, hypovolemic shock, neurogenic shock, septic shock, anaphylactic shock, all kinds of shock, download my surgery high yields course at medicosisperfectionalis.com. To learn about angina, myocardial infarction, ischemic stroke, hemorrhagic stroke, ARDS, many arrhythmias, drowning, hypothermia, hyperthermia, lots of toxicology topics, then download my emergency medicine high yields course at medicosisperfectionalis.com. I help you understand and pass exams. And to master the cardiac pharmacology, such as the anti-arrhythmics, anti-hyperlipidemics, beta blockers, alpha blockers, anti-anginal medications, antihypertensives, diuretics, digoxin, etc., download my cardiac pharmacology course at medicosisperfectionalis.com. There are more than 1,500 videos on this channel, in addition to more than 300 videos available only to those who click the join button and choose the highest tier. Every tier in my membership has premium videos, but to get all of them, go to the highest tier. Please subscribe, smash like, hit the bell. Please support my channel on Patreon, PayPal, or Venmo to help me make more videos. Go to my website to download my notes, courses, and cases, or if you'd like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.